President Trump is halfway toward fulfilling a major campaign promise, getting rid of Obamacare. The House passed health care reform this afternoon, culminating a weeks-long internal battle for the GOP.
This is a great plan. I actually think it will get even better. And this is, make no mistake, this is a repeal and a replace of Obamacare. Make no mistake about it.
But as tough as it was to get the bill through the House today, it may be even tougher to get it through the Senate. We have Fox team covered. Trish Regan in New York with the economic impact of the reform bill. John Roberts also in New York as the president takes a victory lap. But we begin with Chief Congressional Correspondent Mike Emanuel at the Capitol tonight to tell us what's in the new bill and what's next. Good evening, Mike.
Chris, good evening. The vote was 217 to 213, with 20 Republicans voting against the bill. It was just enough to pass. House Speaker Paul Ryan put everything on the line to keep the promise of scrapping Obamacare.
Let's put the patient, not the bureaucrats, at the center of the system.
Ryan's top lieutenant, the House Majority Leader, said Congress is obligated to take action.
Doing nothing leaves too many Americans out in the cold. And Mr. Speaker, we will not stand for that. We tried the Obamacare way. It is failing remarkably.
The House Republican plan would give states more flexibility to go after premium costs. It would stop Medicaid expansion and require those who are able-bodied to work. It would include refundable tax credits for those who don't receive insurance from their employer. It would expand health savings accounts designed to give consumers greater choice and flexibility in buying coverage. And it would defund Planned Parenthood for 1 year, blocking more than $500 million federal dollars.
And our bill actually rescues families by focusing on lowering premiums and putting people back in charge of their health care decisions.
The breakthrough came when Michigan Congressman Fred Upton offered an amendment yesterday that would provide $8 billion for people with pre-existing conditions and announced he now supports the bill. Democrats mocked the GOP's challenge in getting enough support.
Now I have to say to my friends on the other side, you sold out cheap, as we say in New Jersey. The Upton Amendment is, of course, an admission. After 7 years, you came up with this? You gotta be kidding me.
And others called out their Republican colleagues.
It takes real cojones to stand here and vote on a bill that they know provides nearly zero health care benefits for the American people.
Florida Congressman Brian Mast, who's a double amputee after military service in Afghanistan, noted he's someone with a pre-existing condition.
It is a responsibility for me to be the staunchest advocate for people out there that have pre-existing conditions, and that is why I'm such an ardent supporter of this bill.
House Democratic Leader Nancy Pelosi said Republicans walked the plank with this vote.
Our colleagues who have the mantle of being a moderate, you vote for this bill, you have walked the plank from moderate to radical. And you're walking the plank for what? A bill that will not be accepted by the United States Senate.
Now it goes to the Senate, where Republicans have a slim majority.
I sincerely hope, if this bill passes, I pray it doesn't, that the Senate won't mimic the House and try to rush a bill through without hearings or debate or analysis.
I don't think that the House bill necessarily predicts what is in the Senate bill. And we have only 52 senators. There has to be consensus.
The 20 Republican no's mostly came from moderates, some of whom represent swing districts that were won by Hillary Clinton, clearly concerned their political futures could be on the line with this vote. Chris?
Mike Emanuel reporting from Capitol Hill. Mike, thanks.